I think you had a physical therapist that came and spoke with you about what to expect probably at a physical therapy appointment. But it's usually a respectful setting. You have a private room. Your therapist will provide, comfort, consent, and clear communication throughout the session. They're going to collect a detailed medical history. The session will involve a conversation about your symptoms, your medical history, lifestyles, your goals. You may even be asked about your bladder, bowel, sexual function, childbirth history, etc. Then they're going to do an exam, and they're going to assess your posture, more than likely, your spine, your hips, your abdomen, and they're going to assess pelvic alignment. They're going to check to see if your pelvic muscles are tight or if there's any tenderness or any imbalances in the surrounding muscle groups, and in areas like the lower back or even your hips. They're going to do that internal pelvic floor assessment with, of course, consent. She'll do an internal exam and will assess that tightness or weakness, your ability to coordinate, squeezing your pelvic floor muscles. If you're having pain, they will look to see if they can find those areas that are triggering that pain. It could be a particular muscle or, a connective tissue or something. And then, of course, education and feedback. You'll receive that real-time feedback about what's happening in your body with pelvic